Hi, I'm Lindsay, Master Esthetician and Laser Technician here at Olympic Dermatology, and today I was going to share with you a little bit about our Total Skin treatment. Total Skin is a very popular treatment. It really does give you the total skin solution, so it works on skin color, tone, texture, and tightening. So patients have been really happy with not only the benefits that they're getting, but multi-benefits. So you're treating multiple things at once and really getting an effective treatment. So this does combine two different lasers done in one session. So it combines our Genius microneedling with our resurfacing Laser MD. So this particular treatment, we do the microneedling first, which many of you have watched my previous videos on the microneedling and kind of explaining the differences between Rejuvapen and Genius. Those are the two types of microneedling that we do here. If you haven't seen it yet, go ahead and check that out. It gives a lot of information just on kind of the different types of microneedling and exactly what sets this one apart. So this particular device does include the radio frequency. So Target delivers the radio frequency through the needles down into the tissue, down where collagen and elastin produced, which just helps give us the increased odds of kicking up as much collagen and elastin as we can. Now this is something that studies show once you've done a series of treatments, you will increase in collagen and elastin for around 6 months, and then things sort of plateau. So at that point it doesn't drop, it just kind of plateaus. Typically, we are all aging every day, unfortunately, and so we're all getting decreases in collagen just at different rates based on our genetics and lifestyle. So we're trying to counter that and help kick up collagen and elastin production. So this particular device really works on that skin tightening. It's really great for mid-face and neck. We have a lot of patients you can really detail around the eyes. You can get super tight up around the upper brow, down into the lower eye area, and really focus on those areas that we want to really get as much skin tightening as possible. So with our total skin treatment, we first do our passes of the microneedling, really focusing on that deep dermal collagen stimulation. And then after we're done with that, we immediately go into our mild resurfacing laser. Now this particular laser, if you haven't had it yet, is great by itself, but it's also really great in combination with the total skin treatment. This one is called Laser MD. This is a mild resurfacing laser. So kind of imagine like a baby Fraxel. I explain it that way a lot. You know, Fraxel is kind of the stronger resurfacing where you're going to typically have about a week of downtime. With this, it goes a little more superficial because we're getting all that deep collagen stimulation with our needling. We're able to get away with a little lighter resurfacing over the top. And so this particular treatment, you will typically have a little redness that day, light texture, a little rough texture to your skin for a few days, but that's pretty much it. So, you know, my patients, I tell them plan on a week. 3 to 5 days is where you have the most light redness, little rough texture to your skin, but very manageable because so much of what we're doing is going deeper and trying to get that deep collagen stimulation, which really helps make the downtime very manageable for patients, which I think is also why this is so popular. So the Laser MD portion is what's really working more at the surface of the skin to work on like color, tone, when you're working on, you know, pores and texture, brown spots, things at the surface. Think of that microneedling really is targeting our collagen stimulation and really getting deeper for tightening, laxity, those sort of issues. Whereas the Laser MD then is going to work on everything at the surface. So the combination of the two has been such a nice treatment option. Like I mentioned, downtime is very manageable, where patients are really able to get a multi-benefit out of the treatment for brown spots, for pores, for fine lines, for lines and laxity through the mid-face and neck, where patients have been very, very happy with this treatment series. We do 3 treatments spaced about a month apart. Then studies show you'll increase in collagen and elastin for 6 months where things kind of plateau. Then at that point, I suggest kind of a yearly maintenance. So my patients are coming in once a year, countering our aging, keeping that collagen and elastin going, and a really nice routine that's going to help them stay ahead of that aging a little bit. Okay. If anybody has any questions, we do offer free consultations here. Give us a call. We'd be happy to kind of take a look at your skin, see exactly what your concerns are, and see if total skin would be an option for you. All right. Take care.